All right. Hey there, everyone, and welcome to the Daily Coronavirus Update live from Fox. I'm Mike Mibach. We are streaming live right now for you at coronavirusnow.com. This is something we've been doing every day from 10 a.m. on the West Coast. It starts at 1 p.m. on the East Coast time. Just a quick note before we get to the latest numbers here. I mean, when we launched this 2-hour show, we didn't know how long we were going to be doing it. I mean, we thought maybe it would last a day, maybe 3 days, maybe 5 days. For the record, we have now been doing this for more than 3 weeks. It just tells you how big of a story coronavirus, how big COVID-19 is, not just in America, but all around the world. And that's important to note as we go over these next 2 hours. That is why we're here, and we're going to get you the information. And let's start with those latest numbers. Across the world, right now, more than 492,000 cases. In China, 81,000 cases. In Italy, 74,000 cases. And right here in the United States, there are 69,000 cases. In fact, yesterday in the U.S., it was the deadliest day for coronavirus. Again, more than 69,000 cases. More than 1,000 people have died in the United States, 1,046 there. 619 have recovered. Taking a look at the market right now, this is something we also have been keeping an eye on all the time right now. The Dow Jones is having a positive day, the third positive day in a row right now. You can see currently up more than 5%. Now, this is despite the nearly 3.3 million Americans who we found out applied for unemployment benefits last week. Stocks rising again, but also don't forget what the United States Senate did yesterday, and that is approved that $2.2 trillion plan. We'll get the latest on that stimulus package in just a little bit from a live report from Washington, D.C. But right now, I want to go live to Geneva, Switzerland, and check in with Dr. Margaret Harris from the World Health Organization. Dr. Harris, thanks for joining us right now.
Oh, thanks for having me.
Of course. I want to start worldwide. We'll come into the United States. Just something grabbing my attention this morning was out of China. And news that China is going to be temporarily banning most foreigners from entering the country. Just your reaction on that news.
So this is really a response to the problem they now have. They've managed to control their domestic outbreak, so that's the transmission in their population. But now they're facing something that a lot of countries may well have to deal with, is that the outbreak may be reseeded by people coming from overseas. So most of their cases are imported cases now.
Your current assessment of the situation in the United States, Doctor?
You certainly have a very intense outbreak and an accelerating outbreak. So you're in the accelerating phase. And this is where, when it is like that, it's absolutely imperative everybody understand the need to stay apart, the need to be obsessional about hygiene, the need to try to remove the opportunity for people to be too close together for too long.
I understand the importance of social distancing, but like anything, I think it's important to have a partner. You know, and in this case, I think social distancing needs testing. And there's just not enough testing going on in the United States. It's getting better. That's good to hear. But do you think those two go hand in hand?
Oh, absolutely. And you're so right to ensure that that was really a point that was made. Because unless you know where your virus is, you can't stop it. Social distancing is a way of slowing it, but finding every case and finding everybody who's been exposed to those cases and ensuring that those people genuinely isolate themselves, that they stay at home, they don't share bathrooms, they don't share utensils, they really put a bubble around themselves. If you can do that, you will stop transmission.
A lot of United States right now, some people living here in the country don't get it. You know, obviously we see what's happening in California and New York and Washington, even the state of Louisiana now. It seems that we have different rules. You know, do you think that the United States should be on an entire lockdown here in the country?
We don't necessarily say that lockdowns are the only way. For instance, Singapore, that's been one of the most successful countries grappling with this for a long time. They've been grappling with this since January, have not gone into lockdown. Quite a lot of countries have not. So it really is about what works in your community. How do you keep your community functioning, but also doing those other things? The social distancing, the obsession about hygiene, about hand hygiene, not touching the face, keeping the environment absolutely pristine, and also testing, isolating everybody, and ensuring that you can get anyone who's ill to hospital, and at the same time protecting your health workers. They are your gold. They are the people that stand between you and life and death. So they have to be respected and protected.
Dr. Harris, when I look at the numbers coming out of Italy, 74,000 cases, more than 7,500 people have died. When you look at that country specifically, what can we learn from the path coronavirus took in Italy? What can we take out of that here in the United States?
So from that tragedy, and that really is a tragedy for everyone concerned, what we can learn is, again, the importance of knowing where your virus is. So we've been working very closely with Italy, and we found that in different parts of the country, they've got different kinds of outbreak. And when you work it down in your community, so instead of just saying, oh, we've got this massive outbreak in the whole country, look where you are in each community and ensure that you find that virus and you stop that virus. And that way, if you break it down and you really, really work as a community to stop it, you genuinely can.
What's your take on healthcare professionals right now in America, in all countries, doing what they do to save lives and protecting us? How big of a concern is it right now that these individuals are not properly protected as they do their jobs?
So long before this outbreak happened, healthcare workers were under enormous pressure in all parts of the world. We knew that there was a shortfall of at least 18 million healthcare workers. And even though we've been talking about it for years, it's only when you have a crisis like this that you really understand how absolutely critical such people are. So again, it's up to all of us to find ways to protect them. How do you protect them? You make sure that fewer of us fall sick. We make sure we don't fall sick by doing the things we know we can do. The hand hygiene, the understanding whether we've been in contact with somebody who does have a case, and if that's the case, really, really, really paying attention to self-isolation, not going out there. So that, the line that's being said, stay home to protect the health workers, it makes a lot of sense right now.
One more for you, Dr. Harris. A lot of talk about young people here in the United States being infected. In New York, 50% of the cases involve individuals who are under 50 years old. And then just yesterday in the state of California, Governor Newsom had mentioned that of all 18 to 49-year-olds who are tested, 51% tested positive. Should young people be more and more concerned about coronavirus?
Absolutely. Young people are tragically not invincible. One of the misunderstandings at the beginning was the early cases were people who came to hospital, and generally people who are older or people who had other illnesses, hypertension, diabetes, heart disease, they tended to be the ones that got the sickest. So people got this sort of misunderstanding that it was only a disease of people in that category. But now we know the numbers. It's affecting people in all age groups. Small children seem not to have as severe an illness, which is one silver lining. At least our small children seem not to do as badly as everyone else. But unfortunately, young people are getting the severe form and are dying.
Dr. Margaret Harris with the World Health Organization from Switzerland. Dr. Harris, once again, we appreciate your time.
Thank you very much.
Of course, if you're just joining us, you are watching the daily coronavirus update live from Fox. My name is Mike Mibach. Another big story that we are following is that stimulus package that was passed by the U.S. Senate last night, totaling $2.2 trillion as a plan. A lot of Americans are going to get their hands on that money. A lot of small businesses will get their hands on that money. For more information about this, let's turn right now to Washington, D.C. and Fox 5 reporter Tom Fitzgerald. And it was a big night last night for the Senate. But right now, the House of Representatives will not vote on this today, or possibly maybe tomorrow. Okay, it looks like Tom's frozen there right now. But again, $2.2 trillion plan. Right now, investors do like it. The markets have been reacting very strongly to this. This is the third straight day in a row that the markets have been up. First, leading up to it, it was about the talk about the possibility that this could happen. And now it has happened. And then eventually the president will sign it. Hopefully, he said he has given his support. You say we do have Tom again? Okay, we do not have Tom again. One story I mentioned at the top is that initially when we launched this newscast, we were going to do it for a day or 3 days. And here we are 3 weeks in. What I've noticed in my own comings and goings throughout the day in my own livelihood, just yesterday at the market, I noticed when we walk in the door, there are hand sanitizers. wipes, right? So you wash your hands, you throw it away, and then you move into the store and you start your shopping. Here's one thing I noticed going to that store yesterday. Two people in front of me started pulling the hand sanitizers. Not one, not two, not three, 10, 20. Wound up taking the whole bucket. What I'm encouraging people to do is not to hoard. Everyone is impacted in this. We're all one. Remember that. We're not just one individual doing our own. Don't forget about the others, because by the time I walked up and the people behind me, no one could wash their hands. And doctors are saying that is important. Cleanliness is important to fight this. All right, back to Tom Fitzgerald, right? Is that correct? Okay, we're going to Phoenix. It's okay, it's a fluid situation, I understand. We're going to go, Dr. Danny Kwan is joining us. He's an emergency medicine specialist there in Phoenix, Arizona. Doctor, thanks for taking the time. You know, I want to open this one up in regards to what do you think is the current state of the United States when you look at the numbers and the progress of coronavirus here?
Well, we're seeing a lot more testing, and we're able to do more testing these days. So we're able to find out who might be infected and who aren't. But certainly the amount of widespread of the coronavirus is definitely widespread compared to, let's say, even last week.
You know, we do have some viewer questions, and I'll get to those in just a bit, but one of them actually is tied to something I read just this morning, that there were nurses in Washington State who are noticing something regarding symptoms that I hadn't heard before, and that is some redness around your eyes, a little bit under, maybe possibly on the outside, just to the corner of your eyes. What are some of the other unique symptoms that you've been hearing out there?
Well, one is the loss of smell and taste is one of the features of this particular infection.
But if you don't, if there, I mean, that's not all, right? So if I have that as a symptom, should I call my doctor, or do I have to wait for maybe the chills, maybe the fever to kick in, or if I just have something wrong with my smell and taste, do I just stay at home?
You know, that may be, we don't really know if it's kind of a symptom at the beginning or during the infection, but it's certainly one of the interesting features of the infection. Cough and fever are certainly the most important ones to keep in mind.
Okay, let's move on to the second question I got from a viewer. I'm just looking down at it right now. Who should be wearing face masks, doctor? If I feel fine but still have to go to work, is it necessary?
You know, I think social distancing is the best bet in this case. Social distancing will keep you basically apart from the person next to you, but wearing a face mask can help. But you know, the face masks can get contaminated and also soiled, frankly, and that's not necessarily the best thing.
There you go. Those are the face masks. The next viewer question is regarding gloves. All right, I've seen a lot of people walking around town, shopping with their gloves on, out in the park with their gloves on. Can we wash and reuse disposable gloves? That's from another viewer, doctor.
I would not advise washing disposable gloves. I think good hand hygiene in general, washing your hands, using hand sanitizer, those are still the best bets in this case. Because I think if you're wearing gloves, you tend to maybe not be as mindful of the spread of the disease possibly, and you know, you could contaminate other surfaces.
Yeah. Dr. Kwan, this is, so the other day I was in a Walgreens, and one thing I do have at home all the time before this even took place, coronavirus, was that emergency. I don't know if you've heard of it. You put mix it in with 6 ounces of waters and you just pound it and put it down once a day if you're feeling like you are getting sick. That kind of goes into this question. Do vitamin supplements like emergency and airborne, that's another one, work against coronavirus?
The jury's still out on supplements, but certainly to keep your health at its maximum level is the best bet. Emergency can help because it does have a lot of different vitamins in it, including vitamin C. Yeah,
well, that's good to hear because I do take it. I found it. A lot of the store shelves are empty, so I think people are on that same boat. Here's another one for you. Would it be okay to have dinner with my neighbors? I kind of have a feeling I know the answer to this one. We are healthy, and we've already seen each other a few times in just the last week. So can people sit down Let's just keep it, I'll extend this question even further, and I'll say, let's keep it under 10. Let's say it's 2 families of 4. Can they sit down and have dinner together?
You know, that's still a part of social distancing, is to stay apart from one another, because you don't know who is infected, and and there are a certain number of individuals out there that are asymptomatic that can pass the virus along. So I would say that's probably not a good idea.
Yeah. Doctor, what do you think, talking among your colleagues, what's maybe one question you guys have that maybe you don't have an answer to that you think would be very interesting to get that answer?
You know, it's one thing that we don't really know is how easily is it spread from, let's say, tabletops versus droplets versus airborne. And I think if we could kind of get that question answered, it would be very helpful to know which way is the easiest way to spread this. We definitely know droplet spread from sneezing, coughing. Those are probably the most highly contagious ways to obtain the virus. But you know, if you wipe your hand across a table or an object, is that going to cause you to become ill as well?
Well, Dr. Danny Kwan out of Phoenix, Arizona there, I appreciate all you do for all your patients out there, and also for us, as this is a very fluid situation. We're learning from you. So thank you for taking the time to answer those questions from our viewers. And speaking of viewers, if you do have a question there sitting at home, you can always send them to us on Facebook. We're going to be putting some more out there to other doctors throughout the newscast. By the way, we are airing right now on coronavirus.com. This is the daily coronavirus update live from Fox. My name's Mike Mibach. We mentioned the markets up about 5% right now, the Dow Jones, all in response to that $2.2 trillion stimulus package the Senate voted on last night unanimously. The House has not voted on it just yet. Let's go back to D.C. and try and reestablish here with reporter Tom Fitzgerald from Fox 5 D.C. Tom, any idea whether or not the House will vote today or not?
Well, first of all, Mike, thanks for unfreezing me, because that was very uncomfortable.
You're welcome. My pleasure.
Best to be live with you here right now. The answer to that, it's good to be in motion. Here's the deal. The House, we right now know, is going to vote on this tomorrow. And the reason is they're going to do this in somewhat of an unusual way. Now, normally, you know, if you turn on C-SPAN, you ever watch the House of Representatives, you see all members pile in there to the House of Representatives, and they have these 15-minute votes. That's not going to happen for this. The reason being safety. They simply do not want hundreds of members of Congress getting on planes, traversing the country, flying back here into Washington. So the way they're going to do this is by something called voice vote. Now, typically, this is done for, you know, commemorative resolutions, things that are of, you know, sometimes no controversy. What they are going to do is they have to have 2 members on the floor of the House. The House Speaker, Nancy Pelosi, will reportedly preside over this. There is an agreement right now with House Democrats and House Republicans to pass the Senate bill as is. It has to pass as is, because you cannot voice vote something out of the Senate if there are any differences or if there are any changes to the House version. So they will go ahead, they will call this vote, they will do it by voice vote, and then it will be approved, Mike, by the House of Representatives. It's going to be a very unusual scene there. You know, this is a massive $2 trillion bill. You simply don't pass these kinds of resolutions, these kinds of funding mechanisms by a voice vote. It's unheard of, it's unprecedented, but it's going to happen, and it has to happen if they're going to get these monies into the pocketbooks of Americans.
Yeah, very unprecedented, but then again, we are living in these unprecedented times. Don, let me follow up on a question here of my own. A lot of talk about, okay, that's great. I'm hearing about all this money that's going to go into my account. When's that going to happen? Let's say they do vote. Let's say the president signs it maybe tomorrow, maybe Saturday. When is that cash going to get injected into people's accounts?
Yeah, it's the question on everybody's minds. The answer in short form is, if you are an e-filer for your income tax return, you are going to get this money very quickly, direct deposited into your own bank account. However, If you're somebody who gets one of those paper checks, Mike, that could take upwards of 4 months. You know, IRS and the Treasury Department for years have been trying to get people onto that direct deposit platform, e-filing. It is going to benefit those people who have been doing that because the paper checks are not going to be as fast as that direct deposit. We're told the wheels on this would start immediately prior to even the president signing this. So you could be seeing, you know, perhaps 2-3 weeks at the outset. Give yourself about the same amount of time that you get your return from the IRS. That could be a thumbnail for anybody who gets direct deposit when they could see this. We're being told about 4 months right now for paper checks.
Hey, Tom, I got a couple of viewer questions. I'm gonna skip to the first one, or skip the first one real quick and go to the second one here. It's interesting. It says this: I'm assuming, like unemployment and other benefits, still stimulus money is taxable. Will this be taxed?
No. The guidance we have is that this is not taxable income. That's an important question because a lot of people are wondering, you know, if I take this money, if I accept this money, am I then going to be on the hook back to the federal government for this? It's not only for these benefits, but also these small business loans are going to be forgiven. So, you know, remember the idea of this. We're calling this stimulus, but really, Mike, in a way, that's the wrong term to describe what this is. This is a rescue package. This is a life raft. And, you know, when somebody throws you a life preserver when you're out at sea, typically they, you know, are not going to ask you for a refund deposit on that. So think of it in that terms. It's a better understanding of this than perhaps a stimulus package is, which is something we've been using to describe it up until now.
And it's my understanding that most Americans will get something, right? Maybe they don't get the entire $1,200 or whatever it is. It's based on your income. But one other question came in saying, look, maybe I make too much money, and if that's the case, do I still get the $500 little check for every child I do have?
Yeah, from what we understand, the child credit will be per child. Now, I've been cautious about saying things like, oh, this will happen or that will happen, because simply this bill was passed at 1 o'clock in the morning, this morning here in Washington. I would be lying if I said I sat down and I have read this cover to cover.
Right.
But the guidance we are having right now is that that $500 tax credit is in place per child. Now, when you say that, that raises a whole bunch of other questions. Suppose you're a divorced couple. You know, you have shared custody over a child. What does that mean? In short order, one of the best pieces of advice I've heard from a certified public accountant is you should be in touch with the person who prepares your taxes to get some guidance on this. Typically, what we're being told right now is that whatever your tax filing status will be the way the government approaches you or looks at you when it comes to doling out this money. So treasury.gov, remember that website, treasury.gov is going to be where the United States government will spell this out in detail and perhaps, you know, get into those different scenarios, because you line up 100 people right now, they could have 100 different versions of how this would affect them or how they would or would not receive any of these funds.
All right, there you go. Great stuff out there in D.C. with Fox 5. Thank you very much, Tom, for joining us. We appreciate your time. All right, you are watching right now the Daily Coronavirus Update live from Fox, everyone. My name's Mike Mibach. We've had a busy start to this newscast that we are streaming for you every day, starting at 10 o'clock on the West Coast, 1 in the afternoon on the East Coast at coronavirusnow.com. Look, out there, a lot of people are on these shelter-in-places, stay-at-home orders, and it's been a difficult start for a lot of people, especially out in California. We heard the governor recently say, hey, you guys, well, you did it okay, but not great. A lot of the beaches were packed over the last weekend, and he re-emphasized in a news conference during the week saying, hey, this coming weekend, please don't go to the beaches, don't go to the state parks. I think the governor actually closed the parking lots at many of the state parks. Right now with that, let's take it down to Southern California in Los Angeles with Fox 11 Los Angeles. Reporter Sandra Endo with more on the trails and a lot of hotspots out there in the LA area, and I guess they are shut down.
Yes, more closures to tell you about, Mike, and given the fact that Mayor Eric Garcetti yesterday saying, how long is this going to last for? He's saying, anticipating at least 2 months or more, so be prepared, but it's really not going over well with a lot of people who just want to free their mind a little, get some fresh air, so a lot of people flocked to local beaches, beach towns, beach communities over the past weekend, as well as a local hiking trail. So now I'm out here live in the city of Hermosa Beach. This is one of the coastal communities which saw thousands of people come out over the past weekend to enjoy some fresh air, to enjoy some sunshine. Well, they announced yesterday that starting this weekend, Saturday at 6 a.m., they will be shutting down the beach area here as well as the Strand. The Strand is right behind me. It's a popular place for joggers, for people to walk, for cyclists to enjoy some open space free of cars, but clearly it's a problem. And this area is just a 2-mile stretch, but it does connect other beach cities, including Redondo Beach to the south, Manhattan Beach to the north. This is a very long stretch all along the coastline, so the impact of this is going to be a ripple effect. According to city officials here, they say the county may also consider closing down beaches all along these coastal communities as well. What's different here in Hermosa, they own actually this beach and the Strand area. Also, Mayor Eric Garcetti, a council member in Hollywood Hills as well, Councilman David Ryu, calling for the shutdown of Runyon Canyon. That's the Hollywood Hills. It's a popular hiking trail. We saw thousands of people again congregating there over the past weekend. It was a big concern for city officials. They actually padlocked the gates yesterday, shutting those trails down completely. They say they don't want those crowds to come there again this weekend. They say social distancing is the only way we're going to save lives. That's according to health officials, to city officials, and they are on that message on repeat, basically saying people need to stop congregating and they need to exercise that 6 feet social distancing. They're urging people to just stay at home if possible. They can go outside to get the necessities, to get some fresh air, but please don't flock to these beach communities and to these hiking trails, and that's why they're shutting these places down. Mike?
And Sandra, just in your report here, I've seen a lot of people walking around behind you. In your discussions with individuals just today, do you get a sense of a little bit of pushback from people there in the Hermosa, Manhattan Beach area, or do you get a sense that, okay, we agree with this, we're going to move forward with it?
Well, everyone says, look, they're going to squeeze in their jog for the next couple of days until they shut it down, right? And this will be enforced, which is the tough thing to do, policing all along the coastline. Imagine that, having barricades up all along this area. So that's one challenge, according to police officials here. They say that's why they haven't really shut down a lot of these boardwalks. The piers are closed, but a lot of the residents, they get it. They say, okay, you know, we're going to do our part. We'll all in this together. We have to share in this. But clearly, you know, it's so difficult. This is the normal routine for so many people to come out here, get a ride in, get a jog in, and then go along their day. So clearly, though, the weekend is what's going to matter to see what happens, to see if the crowds do stay away.
First Disneyland, and now the beaches there in those coastal communities, possibly for 6 or 8 weeks. All right, Sandra Endo live for us there in the Los Angeles area. Sandra, thank you for that. Right now you are watching the Daily Coronavirus Update live from Fox. My name is Mike Mibach. Unemployment. At one point last week, I heard the number thrown out across the country that we could reach 20% unemployment. How are we going to know? Well, we get the weekly numbers. This week, those numbers just came out. 3.3 million Americans applied for unemployment benefits just last week. That is shattering the prior record set back in 1982 as layoffs and business shutdowns really sweep across the country. We're going to stay right now in the state of California and go to the San Francisco Bay Area and check in with reporter Ali Rasmus. I know the Bay Area, home to a lot of restaurants in San Francisco. Those restaurants are closed and people are filing for unemployment.
Yes, well, this is astonishing. A lot of labor economists who say they've never seen anything like this, certainly not in our lifetimes. This is a record-breaking jobless claim number. Nearly 3.3 million Americans filed for unemployment last week. That is quadruple the record that was previously set in the U.S. back in 1982. Now, here in California, the jobless claims topped 1 million going back to March 13th, and that's when California and various locations like counties in the Bay Area started enacting those stay-at-home shelter-in-place orders. So that meant a lot of businesses had to close down. A lot of people left without work, and nationwide across the country, there have been factories that have had to close, various sectors of the economy, airlines, travel, hospitality, service industry, auto sales have plummeted as well. And some economists are concerned, and obviously in forecasting, that we could see a 13% unemployment by this May, and that the economy overall could contract about 30% by the end of this next quarter. Now, that $2.2 trillion stimulus package that was passed by the Senate last night does provide some help for folks who apply for unemployment, not just from their respective states, but also a contribution to that unemployment check from the federal government as well. But it amounts in California to about $1,000 a person. And here in California, especially the Bay Area, that doesn't go very far. Governor Gavin Newsom has said that he has gotten a commitment from about 200 banks nationwide to have a 90-day grace period and forbearance of mortgages for people who are affected by this coronavirus crisis. But excuse me, some economists worry that this 3.3 million is really just an underestimation of the number, because there are still people who are trying to file unemployment with their various state agencies, and those agencies are really overwhelmed with such a crush of applicants all at once. We've heard reports of people trying to call and report and file for those jobless claims and getting voicemail recordings and messages telling them to try again or to keep trying. They just can't get through. Mike?
And Ali, you mentioned, being in the Bay Area and how expensive it is, and the governor announcing the reprieve or the 90-day, break that people who have mortgages are going to get from those the major U.S. banks. But what about people who rent? There, because not everyone can buy a home. How are they being impacted by this? And do they have a lot of protections right now as we move through this coronavirus?
Well, you're seeing a lot of local entities, local governments, cities and counties enacting their own safeguards to protect people who are renters and call for a 90-day moratorium on all evictions. And so you see, in the absence of some federal action to protect renters and tenants, some of the local municipalities and local governments are trying to step in and fill that void. But already we've heard this morning House Speaker Nancy Pelosi say that Congress needs to start working on the next stimulus bill, that there's not enough in this to really shore up Americans who are financially struggling. And again, the concern is that this first jobless claims report from the U.S. Department of Labor is really just the tip of the iceberg, and that things will continue to escalate. Those numbers will continue to go up in the weeks and months ahead.
Long road ahead. Ali Rasmus there in the San Francisco Bay Area. Ali, thank you for that. Also home in the Bay Area, the Golden State Warriors, and one of their stars, Steph Curry, is actually having a Q&A session with Dr. Anthony Fauci. Dr. Fauci, obviously well known across the country as being an expert on COVID-19. Let's just dip into this a little bit right now and see what they're talking about.
As a country, pull together, don't get frightened, don't get intimidated, use the energy to be able to confront it and do the kinds of things that'll put an end to it. So I want to get rid of that misconception that there's extremes. Either the world is going to end or we don't want to do anything. It isn't that. It's somewhere in the middle.
I appreciate it. I think that's what we all needed to hear. It's what, the reason I wanted to do this and be able to have this FaceTime with you, just because from when anybody's life is interrupted, and whether you've been affected personally by COVID or not, from somebody contracting the virus or what have you, that level of comfort that what we're doing is, what we're doing is in the right spirit of trying to stop the spread as fast as possible, return people to their normal lives, but, taking this seriously and understand that there is a strategy to doing that, and that we all kind of have to adhere to it. So just in that respect, like, where would you send, your everyday person to find that information if we can't get on an IG live and ask these questions? Like, where would you send them to stay in the know?
Yeah, well, there's a couple of websites. There's one called coronavirus.gov. It's part of the CDC website. You can either go into cdc.gov and get into it, or go right to coronavirus.gov. All the information you want is right there.
Perfect. We're going to save this this Q&A, and hopefully people can go back to it and and get all that pertinent information. I appreciate you so much for being available and being selfless enough to have this conversation with me. And thank you again for you and your entire team protecting all of us. And can't thank you enough.
Thank you very much, Steph. It's a pleasure being with you. Thank you for giving me the opportunity.
All right, there you have it. Two
Absolutely.
people really at the top of their games in two completely different ends of the world here. One an NBA star and one a big name in the medical industry, specifically focused on COVID-19. You got a little taste of what they were talking about. Unfortunately, we got the end of it. But it goes to my point at the top of the show. Look, you have two people, one in the NBA star and then a doctor, all coming together to answer questions for one purpose. A reminder that we're all in this together. We are one team as we try to get through this pandemic right now. I know there's a lot of stress at home across the country, especially with parents having to work from home. Maybe those parents have children and they're trying to homeschool them as well. That brings stress. I'm with you on that. I have it every day myself. I'm a father of two and I'm working here. My wife's working at home. I'm also a bit of a gym rat. And I can't go to my gym. I haven't been going to my gym. That adds to my stress. Let's talk about this a little bit more with Dr. Anoop Kanodia, who is a functional medicine specialist based in Columbus, Ohio. Doctor, thanks for joining us.
Thank you for having me. And so many millions of people can relate to what you're saying.
Yes.
Kids at home, gym rat, my best friend does CrossFit. And he's like, I can't imagine not doing CrossFit for 3 months.
I know, and I'm doing my best. I am saying that I'm doing 100 push-ups a day. But even that, I walk away from a doctor and maybe it feels good physically, but it's just not doing it for me mentally. What else can I do?
I think the number one thing is this can-do attitude that we're going to get through this. Also is that stress is unmet expectations. So if we have an expectation that we're going to get back to CrossFit in a week or two, that's stressful. I think also is accepting the fear and overwhelm. Like it's overwhelming for you to have 3 to 4 jobs now. You got your job, plus you got to take care of the kids, plus the shelter at home. That's all stressful. I think that the other things for stress we can do is that have a friend or a buddy that you can relate to. But that's also who's positive, not a worry word.
Right. And also, I was just going to stop you there because there's something also that bugs me is routine. I'm a guy who is very much routine. I go to my job, I do this, then I would go to the gym. I've been thrown off completely, and a lot of people maybe have been thrown off as well. So is it important for me to get a new routine, albeit I may not like it, but for me to get a routine once I get home for physical activity?
It's critical. The people who succeed are the people who have routines. So if you're used to going to bed at 12 and now you're going to bed at 2 in the morning, or you're used to doing, workout in the morning and now you're not doing it, that messes everything up. Having a routine is critical for your mental health and your physical health.
Okay, doctor, I'm going to just look down here. We do have some viewer questions that I want to pass along. So this one's a little bit longer, so then I'll give you a go as soon as I'm done here. Here's what it says. We keep hearing wash your hands and practice social distancing, but how else can we keep ourselves as healthy as possible? What are the most important things each of us should be doing now in addition to what we keep hearing, doctor?
So number one is exercise. Getting outdoors and doing this. There's a whole science out of Japan called forest bathing. And with forest bathing, it's just 20 minutes in nature, improves how long you live and your happiness. And also there is breathing exercises from Russia called Butanko breathing. That also helps us out. The sunlight raises our vitamin D. Vitamin D boosts our immune system. In one study, they had, if you had a low vitamin D, made it normalized, you had a 42% lower rate of flu. Also, sleep's very important. And what I mean is 2 parts of sleep. One is enough hours. So I try to wake up without an alarm clock. We all assume it's 6 hours or 7 hours or 8, but everyone is different. The timing of sleep matters too. There's a difference if you go to bed at 10, wake up at 6, versus go to bed at 2 in the morning, wake up at 10. Sleep is when the body heals. And the quality of sleep also matters. We're finding with the stress that you're mentioning with your life right now and not being able to go to the gym, a lot of people can't fall asleep. So we have people just write in a journal right before bed all of their thoughts.
Right.
That helps them relax, and able to get a good sleep.
I haven't had a good night's sleep in a while, doctor, but I agree with you. I think the more I sleep, you know what, when I work out more, I tend to sleep better, and that works out. Here's another one for you. The foods we should be eating daily that would help boost our immune system.
Right. So let's talk about the foods that actually lower it first.
Okay.
Sugar, alcohol, and for some people, even and dairy can also cause mucus for some people. Now, the foods that we're finding that can help are things high in potassium. It might be garlic. It might be celery. Some of those foods, fiber. All those things help the immune system. The fruits and vegetables. You know, those things are the ones that really boost the immune system. Leafy greens. We don't think of water as a food, but water is important. You know, at least getting 32 ounces of water a day is important for the body.
So you're saying all that Easter candy around the house we should probably throw away?
You know, I think that's phase 2. You know, after we get to the peak of it, you know, of the coronavirus, then we go to the candy part.
There you go. One more for you. This is kind of also just based on my own day-to-day activities, but bonding as a family. You know, so often, you know, we're all spread out, but we found ourselves under the same roof for a lot of time, and we've done that for years, and that's fine. But now all of a sudden we're squashed together nonstop all the time. But it's still important to bond as a family, would you not say, during this critical time?
I think it's both. We need bonding time, but you also need your alone time. Not everyone is an introvert, not everyone's an extrovert. So each family and each family member needs to have a right balance for them. So if your kids are not used to you being there all day long, that's going to be really annoying to them, and that's going to stress them out. Same thing with husbands and wives. So find that right balance of what's best for your family. Every family is unique.
Great point, and a great point to end it on right there. I appreciate your time. Dr. Anup Kanodia, thank you very much. Stay healthy, stay strong.
Likewise, and I hope your gym opens up very quickly for you so you can go back to working out.
It's not going to be a while, but maybe I could increase my push-up amount, and that would help me out a little bit more. But Doctor, thank you again. I appreciate it.
You're quite welcome. Bye-bye.
Okay. Right now, just crossing the wires, too, I just want to give you an update for all you race car fans out there. The Indianapolis 500 has been postponed from May to August 23rd. So just another postponement. We've seen the sports world take a huge hit. Today was opening day for a lot of baseball teams out there across Major League Baseball. Those baseball stadiums are empty right now. Back to some viewer questions, and also want to mention, if you do have a question and you want to send it to us, just do it on Facebook. It's a great way to reach us, and we'll get these questions out. Back to Arizona we go, and Dr. Danny Kwan in emergency medicine. One viewer, doctor, asked about, look, a lot of people aren't getting their haircuts. If I have long hair, if I have a beard, is there the possibility that the virus could get caught up in it and somehow get into my body?
I guess that could be a possibility. You know, again, basically hygiene is the best thing. Keep yourself clean, wash your hair, wash your beard. Those are probably the most important things to do.
What is the most concerning thing for you right now, doctor, as we move along here in the United States? Now currently, more than close to 70,000 cases here. Moving forward, what is your biggest concern?
You know, running out of protective gear, running out of the face masks and the gowns and the gloves, all those things are very important to protect healthcare workers, and I think you know, we just really are looking forward to getting those supplies back into the hospital.
You know, from someone from your vantage point in the medical field, I'm curious. Because there has been some criticism about the federal government just not acting quick enough, doing enough right now for people like you in the medical field and helping out the hospitals. From your vantage point, what grade would you give the federal government? Do you feel like they're doing a good job, not a good job?
Well, I think this is a time that is testing all of us, whether it's the government versus our healthcare system. This is a trying time for everyone, and we just need to work together to achieve the best outcome, and that is saving people's lives.
Mm-hmm. Yeah, nurses, doctors in Arizona, have you heard stories about these individuals just being overwhelmed by the amount of cases they're seeing, by the amount of work that they're doing, maybe working doubles in some cases?
We're all working really hard. We know that our goal is to take care of patients, and so as a healthcare worker, we do as much as we can when we can to help as many people as we can.
I'm curious, there's also been talk about nursing students, so close to graduation, but not quite there, but they're not being allowed into hospitals to finish what they need to do in regards to their training. Would it help if that maybe there was a waiver that said, hey, let's get these nursing students, up to speed. Maybe they can do some virtual training and then just, let them loose, get in the hospital, because we need the more bodies we have, the better we're going to do.
I think at this time we have enough healthcare workers at this point to take care of the patients, and maybe we definitely need to reevaluate that as we move further into this pandemic.
There's also talk about mass transit. People scared to take mass transit because I don't want to touch this, I don't want to touch that. There's a possibility that I could get the coronavirus. In your opinion, do you feel like it's okay to be on mass transit right now, or do you feel like mass transit agencies should start looking into the possibility of maybe cutting back service if they haven't already, or possibly just shutting service down?
I think it depends on the transit agency as well as the people riding. Definitely, as we see in Asia, they go through the cars and the buses, and they basically sanitize the whole vehicle, and people are respectful of each other and try to give each other room. Now, I know that's not always a possibility, but people do need to move from one place to another, whether it's for work or to go to to their appointments. It's certainly something that we have to try to accommodate.
Got it. Dr. Danny Kwan, again, out of Phoenix, Arizona. Doctor, thanks for staying with us during this hour right now. We talk about so many patients in the United States right now, more than 69,000, and that is on the rise over the last 3 weeks. Let's talk to someone who has tested positive with coronavirus. And to do that, we're going to go back out to the San Francisco Bay Area. Someone we've talked to before, his name's Ryan O'Donnell. He's just north of the Golden Gate Bridge in the city of San Rafael. I think last time we talked, Ryan, it was St. Patrick's Day. You were under quarantine at your house. And just give us the update here. How are you feeling right now?
Yeah, I'm feeling a lot better. I've been a week without symptoms, and I've been cleared to kind of go about being, careful walking around and stuff like that. But I can go to the store and get supplies if I need to. So, yeah, I'm a week past it. So
yep. Hey,
I feel great.
For our viewers who are just joining us, you are watching the daily coronavirus update live from Fox. My name's Mike Mibach. This is Ryan O'Donnell. And again, for those viewers across the country just joining us, Ryan, take us back to when you first felt like something was wrong. Describe those symptoms.
Yeah, so I kind of felt the headache coming on and kind of felt like maybe it was allergies. I felt some sinus pressure building up. And that night I kind of I thought I was having a fever, but I actually had a low temperature, kind of below average, like a 96-degree temperature. Luckily, well, not unluckily, I had been traveling through Europe at the time, and I was able to get tested, even with very minimal symptoms, and it came back positive. So even though I didn't have a fever and I didn't have like a cough or anything like that, it came back positive. And yeah, I'm just trying to spread the word to people that you don't have to have super severe symptoms to, have the virus inside of you and be contagious.
So you're a family man, you're married, you have children. How's the family doing? I mean, how's it been? Have they popped up any symptoms among them?
My family has not had any symptoms, and before and after and during, I have not been self-isolating from them. It just happened that we were all together, and all three of them have gotten negative tests. So we seem to be good in handling it as a family just fine.
69,000 cases across America, Ryan. I know you're not a doctor, but you've been involved in this story as someone who tested positive. Where do you see this going over the next few weeks?
Well, I mean, obviously, everyone's got to stay home to limit the exposure to people that, that are vulnerable and that can get really sick from this. And there's no age group that's safe. They're showing that a lot more people are getting sick in the 20 to 50-year-old age group. I really hope they have an antibody test out there soon that we can figure out who has this, who has immunities. And maybe in a few weeks, if that's there, people can start going back into the world and knowing that they have the immunities to fight this thing off. And we could start kind of going back to, not being as fearful going out the front door.
Yeah.
But I don't see the world starting up again in a couple of weeks. I think it's going to take a while to figure this all out. And right now, the front lines are fighting the sickest people that are going to keep pouring into the hospitals.
Hey, and you were saying that you actually started a Facebook page since you've been staying at home, and just people have joined talking about their experiences. What have you learned from that, from listening to others out there?
Yeah, it's good to get a group like this together because we talk about symptoms that we've had. The one thing I've learned is that it seems to be different for everyone, that it, kind of hits their bodies in different ways. A lot of people are a little scared out there, but the groups like this kind of help community-based sharing. It kind of helps ease people's fears and show that we can handle it. And there's no real medicines that are working. So, traditional stuff that you've learned or people can share, like, cleaning out your nose in a steam shower. Just home remedies tend to be working and sharing and easing people's fears and anxieties. And it's good to have this type of support at a time like this where it's really important.
Yeah, keep the immune system strong. I mean, when you were in quarantine, is there something you missed the most that you're excited to do that you haven't done in a while?
Yeah, just going out and taking a little open air bike ride. Definitely have enough time hanging out with the kids. They're yelling for me right now. Hey, guys. Oh. But, yeah, just going out and seeing friends and stuff like that, And we always call people and say, hey, what are you up to? And the joke is we're all doing the same thing, trying to figure it out.
There you go. Trying to figure out. We're all doing that one day at a time. Ryan O'Donnell, there in the city of San Rafael, just north of San Francisco. Ryan, glad you're doing good, and thanks for checking back in with us.
All right, Mike, thanks.
All right.
Take care, everyone.
Sounds good. Right now, you are watching the Daily Coronavirus Update live from Fox. My name's Mike Mibach. We do this every weekday starting at 10 in the morning on the West Coast, 1 in the afternoon on the East Coast. One population, a lot of questions about this population, homeless population, where they're staying. Are they being tested in this quarantine process? For more on that, let's turn to reporter Brooks Giroux, who has this report.
Everybody's talking about it, and some folks are really worried about it.
Stress may be an understatement for those experiencing homelessness, especially with fears of COVID-19.
There's nothing on the shelves in the stores. We need it. We need it out here.
Medical experts say those helpless feelings can compromise immune systems, and with lack of sleep or poor nutrition, it puts those living in encampments at a greater risk.
They gave us the packets, and they also gave us hand sanitizer.
Here in Berkeley, the city health department quickly took action, providing maps to washing stations.
I didn't know that they would actually care enough to make sure that we were okay.
And going tent to tent, spreading a message.
This is the first time I've actually opened it.
Inside, handouts with precautions, symptoms, and a plan of action in case someone gets sick.
They're actually concerned about our health in this camp.
They're encouraging sanitizing, social distancing, and improving daily hygiene.
So up here is where our hand washing station is.
For the 108,000 unhoused homeless in California, this at times can seem like a luxury and now a lifesaver.
There is no medicine as powerful as housing. And so when we have this other crisis overlaid on top of an existing severe homelessness crisis, we're going to see the effects tragically.
Dr. Margot Kuchel directs the Center for Vulnerable Populations at UCSF. She says in San Francisco, no one experiencing homelessness has confirmed to have coronavirus, but many could be infected and just haven't been tested.
It really creates this impossible situation.
San Francisco has set up dozens of hand washing stations, bathrooms, or pit stops to help with hygiene. The city has also secured at least 30 RVs to separate or quarantine entire encampments if infection occurred on the streets. The other big risk is homeless shelters, often packed with people that eat together at common areas. That only elevates the chance of spreading coronavirus.
That's exactly what we don't want. And if an infection were to get into that community, it would be at high risk of spreading.
National data shows 560,000 Americans were homeless on a single night last year. But add in those with substance abuse disorders and mental illness, and the challenge becomes more complex.
We'll make sure we secure the resources to get folks off the streets quickly and into those units. 7 counties now have already secured beds for homeless.
Governor Gavin Newsom wants 51,000 hotel rooms to house those who are homeless. But Dr. Kuchel says in some cases it could do more harm than good, especially for people with alcohol or drug addictions who may violate quarantine rules.
The worst thing to be doing right now is we don't want to be taking people who are outside, not infected, and forcing them to move into enclosed spaces. That would be a disaster. If people are outside and they're safe there, we don't want to be forcing them to move in, if they're not infected, because that could be placing them in harm's way.
This is currently where I reside.
Some have told us they've researched or learned about the do's and don'ts from health officers.
I'm not afraid to be out here.
But others,
I'm very worried about it.
feel forgotten.
Nobody's come by Oakland. Nothing.
Despite some new sanitation stations, replenishments and routine cleanups in Oakland don't appear to happen often, leaving them to take matters into their own hands. And with roughly 50% of homeless over the age of 50, safer spaces are essential.
We need to insist that places be provided for those who are homeless to protect their health and the health of everyone we come in contact with.
Oakland City Council president wants to get those most at risk off the streets. 2 hotels were secured by the Oakland airport with the help of Alameda County. But progress has been slow because of medical staff, laundry, food, and security all have to be set up first.
We need help. We really need help. We're going to catch this virus if nobody helps us.
For now, many on the streets are just trying to keep to themselves, hoping someone will soon listen.
Please come, please.
All right, Brooks Giroux joins us live right now. Interesting story there, Brooks. When it comes to testing, I'm curious there, the homeless population, is it actually being done out there on the streets? Are people packing up in vans and going to meet these people and give them tests?
Well, we have heard from several cities that have actually had their firefighters go tent to tent and perform some tests. So far, no one in the San Francisco area has come down with positive cases of coronavirus, but we did hear in Santa Clara County, there was 1 death, so 1 fatality. And in many cases, we don't know who else may have it and if the infection is spreading because of the limited tests. A lot of cities just aren't making it a priority or just don't have the resources to be able to do it.
You say an interesting word there, and that's priority. And unfortunately, for a lot of people out there, the homeless population is not a priority, especially when you're dealing with a pandemic. They're worried about their own lives and their own families. Is there concern that not enough is being done to protect the homeless population, at least where you are?
Well, I think there's that feeling out there. Mm-hmm. There are some efforts there, and I know that even the governor in the state of California is very nervous about this because doctors we spoke with said this could spread like wildfire if it were to get in an encampment. So there are procedures and things that are going into place right now in order to be able to separate people. The key is to get people tested. But if we do know that there is someone who is symptomatic, separate them from the community and get that entire encampment to spread out. That's the message they're trying to spread to all those people on the streets is stay away from each other, keep to yourself, and wash your hands as much as possible.
Those are encampments, but there are homeless individuals who have made their way, over the weeks and months into shelters. So, that's a whole different story, I guess. But what's the word in how shelters are preparing or dealing with coronavirus and those who are there inside right now?
That's a great point, Mike. Number one, what they need to be doing is staggering meal times to make sure not as many people are in those common areas. They're able to separate, have that social distancing we often talk about. The other thing is when they're sleeping at night, rather than having everyone next to each other sleeping in the same direction, it's really advised that people go foot to foot. That way you have more room between one person's head and another person's head in hopes of, if someone is infected, keeping it from spreading.
One more for you, too. I mean, not everyone is homeless here, but what if you have symptoms and you don't necessarily have a house or an apartment to go to quarantine? Are they opening up? Well, I guess in California, the governor mentioned maybe hotel rooms being a possibility, but where do these individuals, where can they go to quarantine here?
Well, this is really something that we as a community have to answer. Number one, the doctors are saying that we need to have a separate place that we can pull people aside and immediately quarantine these people away from the bigger population. If you leave just one person, infected in that kind of community when they don't have access to showers or bathrooms every single day, that's only going to pose bigger problems. The other important thing to keep in mind is the economic ramifications we could see as this continues to have an effect on the economy, especially in the Bay Area, where rent prices are really high as well as home prices. You could see more people becoming homeless. And if they're stressed out about that and they are forced to the streets, that only makes them even more susceptible to coming down with COVID-19 or easily coming down with health complications from this, and it could be much more serious.
That's a great point, the economic impact of all of this down the road. Brooks DeRose out there in the San Francisco Bay Area. Brooks, thank you for that report. For those just joining us, welcome to the Daily Coronavirus Update live from Fox. My name is Mike Mibach. We do this every weekday, Monday through Friday. We begin at 10 in the morning on the West Coast, 1 o'clock in the afternoon on the East Coast, really giving you the latest information about the coronavirus outbreak nationwide. Speaking of the latest information, just popping on the wires right now. Excuse me while I turn and look down here. This is just coming in from the president. According to the Associated Press, President Trump is now eyeing easing of guidelines. Says feds to offer categorizing counties by high, medium, or low risk of virus spread. A lot of talk about whether or not the entire nation should be in a shelter in place or a lockdown. Obviously, a lot of states have done that, including New York and California. So here we have President Trump, apparently, according to the Associated Press, saying, I'm going to ease up the guidelines. Remember, he threw out that Easter deadline. Easter this year lands on April 12th, of possibly getting things back to normal. But here, it could be that counties across America could be locked in as a high risk, a medium risk, a low risk. So that's all we have on the wire. I'm assuming if it's a low risk, maybe there's a potential the shelter in place would be lifted. If you're a high risk, obviously that shelter in place stay-at-home order would remain in effect. Stock market, we've been posting it there for you down in the bottom left part of your screen. We're going to bring it up full here. It's been a very positive day for the market. This despite the unemployment numbers reaching high numbers, 3.3 million filed for unemployment claims last week. But again, the U.S. Senate passing that stimulus bill just last night. $2.2 trillion. The House expected to vote on that most likely tomorrow. Numbers also we're watching is the number of coronavirus cases across the country. Right there, you can see worldwide, we're getting about 492,000, close to 500,000 cases across the world. In China, 81,000 cases. Those have not really risen over the last week or so. Italy, 74,000 cases. And then right here in the United States, you can see close to 70,000 cases. More than 1,000 people have died in the U.S., 1,046, 619 have recovered. Now, I've done this 2-hour newscast before a few times, and I keep notes. And I'm holding up one of them. So I'm just playing off what you saw there on the numbers. This is dated March 18th of 2020. And I wrote down the number of cases in the United States, 6,500 cases. So that was what? Do the math, 8 days ago? 6,500 cases in the United States. 114 people had died. 8 days later, 69,000 cases. More than 1,000 people have died. Puts in perspective just how quickly the virus is moving around the country right now. Next, I want to check in with Dr. Rabia De La Tour. And I'm sorry, doctor, if I'm pronouncing that incorrectly, but thank you for joining us right now. You're with the NYU Orthopedic Center. You know, I read those numbers, you know, from March 18th, and here we are, 69,000 cases. With most doctors I interview here, I like to get your perspective, your state of the union, if I may, of the coronavirus here in the United States.
Yeah, so unfortunately, the numbers seem to be rising despite our best efforts with, social distancing and canceling large events, closing schools. It still seems to be on the rise. And that's because in crowded cities, unfortunately, no matter how hard you try, unless you really are running a totalitarian state, there's going to be interaction of people and spread of disease. So unfortunately, we're still on the upswing. It appears to be slowing down, perhaps based on social distancing attempts, but it's not going to be where we want it to be just at this point. And I think Dr. Fauci brought up a really good point recently, which is that the timeline is not going to be determined by us. It will be determined by the virus. So unfortunately, things are still going to get worse before they get better. And that's kind of the current state of affairs. And sadly, I live in New York City and I work in New York City as a healthcare provider. Things are quite bad here. They're going to get worse. And unfortunately, we're going to be seeing things get worse in many other cities. You can already see in New Orleans, things are getting bad and they're going to get worse. And unfortunately, we're going to see the death toll rise.
Doctor, I read a line, I think it was in the Wall Street Journal yesterday, from one doctor, also from New York, from Long Island Jewish Medical Center. And he said, quote, "We're getting pounded. I'm in the ICU. It's the worst I've seen in 15 years. You're in New York. You would agree with that assessment?
100%. I have been working in New York in the hospital during Hurricane Sandy and since then, and this is the worst I've ever seen it. I have colleagues who are symptomatic and unable to be tested. I mean, that's obscene. No healthcare provider should be knowingly going into a COVID positive patient's room without appropriate PPE or protective gear. And then once they're symptomatic, not be protected by their own healthcare system and government to be tested. I have close friends, even family members who are in the healthcare industry, and they've had symptoms and been unable to get a test.
What's your take on New York? I mean, why New York? I mean, obviously, the population itself, we understand that in New York City. But when you look at the map at the country and you see, the Bay Area, you see Washington State, you mentioned Louisiana, New Orleans. Why New York right now?
Well, you saw it start on the West Coast, right? Because the travel from China is easier on the West Coast than it is here. But it was only a matter of time. We knew from January and even December when we started hearing about these cases in the Wuhan province in China that it was going to come to New York. And once it got here, it was going to be mayhem. I did an interview for another Fox station in January saying that with Chinese New Year coming up, things are going to get bad and we're going to be dealing with an actual pandemic. I think we all saw this coming in the healthcare field because New York City is so populated. There's 8 million people who live in New York City in the greater metropolitan area. There are millions of people who commute in and out of the city every single day for work. It is absolutely impossible to tell every single person in New York City to stay at home. Obviously, healthcare workers are going in and out of work. NYPD is going in and out of work. Firefighters, EMS. It's impossible to have everyone stay at home. And that's really the only way to flatten the curve is to have people practice social distancing. But in a city like New York, that's virtually impossible. And so for every one person that is going out and about who may not have symptoms yet, but is carrying and shedding the virus, they're going to spread it to at least 3. And after 30 days, that really will balloon into thousands of people being infected from just one.
Yeah.
And there's no cap on this, right? The virus is not going to be like, all right, I've reached maximum capacity and I'm going to stop spreading now. It is an infinite ability to spread to as many people as possible. And the sheer fact that people are asymptomatic for, up to 2 weeks and shedding virus, and they may even test negative during that point if we were to do universal testing, is why it's spreading so much, because people don't know until they are symptomatic to stop going out and about and to practice self-quarantine. And so until that happens, they're spreading the virus. And that's why we've seen such a boom in the entire world.
And a boom among young people. I mean, there in New York City, I think 50% of the cases involve those under the age of 50. And then out west in California, of all the 18 to 49-year-olds who were tested, 51% tested positive. So it's not just the older population.
I think a really important thing to note is that, like I mentioned, I have close friends and family members in the healthcare industry who are symptomatic and likely have coronavirus, and they cannot get a test. So the numbers we're seeing of positive test results are not accurate. There are thousands of people, and healthcare workers included, who are not able to be tested yet. And I was on the phone with the Erie County Department of Health 2 days ago, pleading with them to try to get a test for a close family friend in Erie County, where I'm originally from. And they said, unfortunately, Quest Diagnostics could run the test, but we don't have enough swabs to run the test. And this is a healthcare provider who has sacrificed their entire life trying to help their patients unable to be tested. And so these are really dire times. We need to fix this problem immediately to try to get a hold on the actual disease process and try to get it to flatten the curve, essentially. So the issue now is, if you're looking at the numbers of people infected globally and they're not accurate, all we can really rely on is the death toll, because that's what we actually know. We have like a firm grasp on the actual number of people dying, but the actual number of diagnosed people is not accurate at all. It's much higher than what is being reported.
It's interesting. I have a niece who works in New York City, and she left about a week ago and went back to California, is now living with her mother. She did get tested and is in quarantine there. The results haven't come back. But on that note, if she were to test positive, and this goes to anyone, the question is, can you get it again? So we just interviewed a gentleman named Ryan O'Donnell. He tested positive out in California. He says he's better now. He's probably be okay next week. But someone who tests positive, can they get it again? Do we know that yet?
We don't know that yet, but as is true of most viral illnesses, you will eventually form antibodies. But look at the flu, for example. That's kind of what our litmus test is for this, because the coronavirus, there's many different forms, and the common cold is one of the diseases caused by a strain of the coronavirus. Now, this is the novel coronavirus. COVID-19 is a new form of the coronavirus, a mutated form, and we don't know yet. Hopefully, that's not the case. But as is true with the flu, even if you get a flu vaccine for the 3 or 4 strains that are being most highly spread during whatever year, you can still get another strain of the flu. And there's countless people, myself included, who get the flu vaccine every year and can still test positive and get the flu. I got the flu 2 years ago, even though I had gotten the vaccine. It was just a different strain. So we're not really seeing that yet. My hope is that once you form antibodies to the coronavirus, you hopefully will not get it again. And luckily for us, the coronavirus that we're seeing spreading through the world, we have the genetic code for it. The Chinese scientists who found the code shared it on the internet, actually, and that's been helping us to develop a vaccine. But luckily, it's not been shown to be mutating aggressively, which is one of the only silver linings of this whole thing, is that if we do find a vaccine, it'll be effective, because if it were to mutate heavily, then those vaccines wouldn't be effective. So that's one good thing that's going on here. So to answer your question.
Yeah, no, thank you for that. And I mentioned my niece is staying with her mother. Her mother's a nurse. And so to all the nurses and doctors out there, I mean, they're all brave right now, protecting us, doing what they do day in and day out. And you mentioned earlier that, these individuals need to get tested themselves. And I agree with you on that. We're hearing stories of just not enough staff in certain hospitals across the country. They can't handle it. As someone who's in the business, I'm curious, there's so many nursing students out there who are so close to graduation. Would it help if they just kind of just said, all right, you're good to go. We need you in hospitals right now. Have we gotten to the point where we need to start doing that?
That's a great question, and my hospital is actually doing just that. NYU School of Medicine has offered fourth-year medical students who are about to graduate in June the opportunity to become interns right now, to get on the payroll, to get all the benefits of being an intern, which is a first-year trainee, if they were amenable to working in COVID wards and helping out with the hospital. We are grossly understaffed as a country in general, and this is just going to put a stress on the system even more. It already is. We all talk about increasing the number of vents and increasing the number of hospital beds, but you can have a ventilator. You need to have a doctor and a nurse who know how to work the ventilator. You can't just throw in like a psychiatrist to go and work in an ICU ward. It's not how it works. I just think it's very important that we, as we're doing, New York State has actually called in all retired healthcare providers to come and chip in, and there have been 40,000 people who have volunteered already to come and try to help this system, which is essentially at max capacity and on the verge of being broken if we don't act quickly and act fast.
Got to act quickly. Great conversation, Doctor. I appreciate it. Thanks for all you do, and thanks for chiming in here.
Thank you for having me.
Of course. Again, time now is 11:16 on the West Coast. You are watching the daily coronavirus update. We do it every day for you from 10 in the morning on the West Coast to 1 in the afternoon, or to noon. We start at 1 in the afternoon on the East Coast, giving you all the latest information and updates about the coronavirus, about this pandemic taking over our country right now. Again, I told the story a little bit ago how we are all one in this together. The other day we were at this grocery store, and they do have these wipes that you hand out. So you just go right up to it, the little can, you pull out a wipe, you wash your hands, and then you go into the market and you go and do your shopping. An individual, just a couple people in front of my wife, sat there and pulled wipe after wipe after wipe after wipe after wipe. So the individuals behind this person, when they got up there, they were all gone. Hoarding wipes. You can't do that these days. I understand there's shortages in grocery stores, and they're doing their best to stock those shelves. But an act like that, in broad daylight, just taking someone sitting behind you, I think it's important to note and important to tell that story because, again, we are all in this together. We've had stories about the homeless population. We've had stories about the medical community, individuals, teachers, parents, students. We're all in this together, and it's important to remember that. Right now, I do want to go out to Texas right now and talk about, we're not ready right now. So what I am going to do is get an update on the markets for you right now. We're going to talk about the prison population, what to do with inmates, prisoners. There are some instances of inmates in county jails being released. We're talking about low-level individuals being released into the community because they don't want them to be inside the jail, concerned that they may get the virus in the jail. I mentioned the markets there. Again, keeping a close eye on this because the Senate just last night voted to pass that $2.2 trillion stimulus package. The House of Representatives has not voted on it right now, but House Speaker Nancy Pelosi did mention that there is strong bipartisan support for that bill and should be voted on as soon as tomorrow. Again, we're talking about prisons and jails, and I do want to take us now to Texas and Carrie. Carrie, is it Blakinger or Blackinger? I'm sorry.
It's Blakinger.
Blakinger, thank you for that. With the Marshall Project to talk about the inmate and prison population. You know, I heard Rudy Giuliani, the former mayor of New York City, say the other day, you know, leave them in there. There's no reason to bring them out. What's your reaction when you hear that?
Well, I mean, I think that it's pretty well understood that people in jails and prisons don't really get good medical care. But I mean, it's also an issue in terms of it's a lot easier for these things to spread in a prison or a jail environment because you really just can't do social distancing.
I think Texas had an inmate test positive. I mean, if that happens, what's the course of action? Do they go into isolation? Tell the story of that.
So what Texas is doing is the one, and this is for the state prison system. There's also been some positives in the Dallas County Jail, and just today they confirmed that there was a juvenile in the Harris County Detention Center that has it, the juvenile detention center here that has it. But in the state prison system, there's one confirmed positive among the inmates, and that person has been medically isolated. So that, you know, looks a lot like solitary confinement, but it's in the in a prison medical hospital setting. The rest of the dorm, the other, 57, 58 guys that had been living with this person are all medically restricted. So they've basically just quarantined that dorm. So that's sort of how Texas is dealing with it. But, at some point, if this becomes more widespread, that could be problematic to do just based on the amount of dorm space versus cell space that some of these facilities have.
Yeah, I was going to say, where do you put them? I mean, where do you put these individuals?
I mean, it depends on where they're being housed and how many cells and how many dorms there are. But, also, I mean, I asked the prison system, like, okay, if you end up with a lot of people that are positive, like their hospital, they have a hospital ward in Galveston, but it's not that big. And I said, like, okay, what happens if you have a large number of positives? Like, what are you going to do with that? And they said they had a plan and that it is a good plan, but that for security reasons, they couldn't share it.
Now, some prisons use those private companies for healthcare. Is there any concern about that part of this story and that maybe the public doesn't or is not able, I guess you could say, to keep track of the care that they're getting in those facilities?
Well, I think it's really hard for the public to keep track regardless, whether it's contracted out or whether it's something that's provided by the facility, or as in Texas, we have it that the providers are University of Texas Medical Branch and Texas Tech. So it's university-based like hospital or medical care providers. But regardless of how you do it, it's difficult to track. I mean, privacy laws vary by state in terms of what can be released about specific inmates, which can make it hard to verify some of the claims that you get. But I mean, as a whole, it's not good. Prisons and jails are not typically, even if it's, whether it's contracted out or whether it's done themselves. I mean, you can just, wherever you are, you can just Google when the last time your jail was sued over bad medical care, because it's probably happened.
Hey, Carrie, what about families in visitation? I mean, I guess this also depends on what state you're in, but visitation rights. I mean, the important times to bond for an inmate and have their family come and visit. Are people being allowed to still see inmates?
No, I mean, they're not. Many jails, I think all of the jails in Texas, any of the prison systems that I've been looking at, they've all cut off visits. And I mean, that's not to say that that's something that's unmerited. I mean, clearly there's risks of that. I mean, of having visitors coming in and out of these facilities. The same risks that, having COs come in and out every day also presents. But of course, when you don't have visitors coming in, that makes it harder for people to reintegrate afterwards if they don't keep up these family bonds and maintain family relationships. And, it's also, it can pose a risk in terms of violence. Like, people have less incentive to behave if they aren't worried about losing their visits. The person that sort of holds them down and keeps them from just sort of losing it might not be able to see them for a while.
Yeah.
So, when you take away visits, it tends to have pretty clear and sometimes very immediate impacts on behavior and, risk and violence within these facilities.
All right. All important conversation here right now with Carrie Blakinger with the Marshall Project. Carrie, thank you very much for your time. I appreciate it.
Thanks for having me.
Of course. When you look at the map of the country and you look at all the states, we've been talking a lot about New York with the most cases across the country. We've been talking about Washington and California, but another state that's getting hit hard is New Jersey. 4,400 cases, at least 62 people have died. Being told that a news conference is underway right now with the governor, Governor Murphy, in Trenton. Let's listen in for just a bit here.
Any other bullying or vilification of communities, one community or another, is it's normally completely and utterly acceptable. It's even more so today. And I repeat, there is a special place in hell for the very small minority that do that. And again, doing that is not only is wrong in a moral and ethical sense, it's just simply wrong based on any fact basis you could possibly find. Every community in New Jersey is taking its role in this emergency with the utmost seriousness and gravity. I've spoken with countless community and faith leaders who continue to tell the people around them that now is no time for business as usual. It's also no time to panic, and it also is a time to come together as never before. And we are one family, period. And we will get through this as one family. Our New Jersey values are the glue that holds this family together. And it's what will define our response and our resilience. So to everyone in New Jersey, keep doing the things you're doing to protect this family. And I'll repeat, as I've said before, unequivocally, we will get through this. Not unscathed, as we've already seen with the loss of life, but we will get through this, assuming each one of us, each of the 9 million of us in our family, does their part, hangs together, that this is a war, and we accept that we win wars when we don't panic, but we get smart, aggressive, proactive. We don't turn on each other. We come together. We show courage. We are doing that. We will do that. And we will win this war as we have won so many before. Thank you all. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon, everyone. We continue to see our older population and individuals with underlying conditions to be more severely impacted by COVID-19 illness. As I've said before, we know our long-term care facilities are particularly at risk because of the populations that they serve. In early March, we held a conference call with these facilities to review important prevention and preparedness activities. In addition, on March 13th, the department required that these facilities restrict visitors and screen all staff for respiratory virus symptoms. However, we are still seeing more of our long-term facilities being impacted. Right now, there are 43 of our 375 long-term care facilities.
All right, been watching that news conference out of the state of New Jersey. Again, New Jersey with at least 4,400 confirmed coronavirus cases. So far, 62 people have died there in the state of New Jersey. I want to bring back in right now Dr. Latour. We spoke with Doctor a little bit earlier, and Doctor, you are you practice in New York, and one thing I wanted to ask you was about turning the buildings or, event centers or concert halls into these makeshift hospitals. Are we seeing that on the ground more and more?
Yes. So the Javits Center, which is a very large convention center that has multiple different events at it, it's humongous. They have turned that into a makeshift hospital. I work at Bellevue at NYU, and we have another makeshift tent outside. Unfortunately, that's being used as a morgue. But we're creating space wherever we can. We've converted a bunch of hospital wards within Bellevue Hospital itself into COVID wards, and we're doing whatever we can to increase the number of spaces for patients who are suffering from coronavirus and need hospitalization.
I mean, if those hospitals are packed and then these are opening up, where's the staff coming from?
That's exactly the issue we're facing. We need more staff. And so, like I mentioned earlier, we are asking people to come out of retirement. We are graduating medical students early. We're doing whatever we can to increase the number of boots on the ground because, like I said, if you have more vents and you have more beds, you still need people to work those and to be able to manage them. Ventilators themselves are very complicated machines. They are not something that any type of doctor can really manage or any type of nurse can manage. They require special training and years of training for people to do that. You need respiratory therapists, you need patient care technicians. Healthcare is very complicated. It's not something that you can kind of put a Band-Aid on and fix just by having warm bodies. You need people who are specially trained or else people will die. And that's why this is so frightening for all of us within the healthcare industries, because we ourselves are scrambling to try to create expertise wherever we can. But unfortunately, if we get sick, then who's going to take care of the patients? And that's why not having enough protective gear is so frightening for all of us. The CDC has loosened its regulations in terms of what we should be using, which is horrifying for me as a healthcare provider, because had we been given these loosened restrictions a few months ago, we would have been fired from our jobs. To go into a patient's room without the proper protective gear, not only are you putting yourself and your family in danger, you're putting the next patient you see in danger. So for the CDC to have loosened the guidelines based purely on the fact that we don't have enough protective gear is really quite frightening and makes me as a healthcare provider afraid for myself, my family, my colleagues, and it's not right.
You mentioned ventilators. I mean, how big? We heard the ventilator debate going on for weeks now, that states just don't have enough. The federal government isn't doing it. The president has said if the governors want it, go ahead and order it. We'll get you ventilators when we get there. I mean, how short, if you could put it in perspective, how short are we of these ventilators?
So as of right now, there are a few hospitals that have reported running out of ventilators. I think the major issue with ventilators is most governors are trying to get ahead of the ball, which is something we haven't been doing as a country as of yet. We have not been doing anything to try to prevent deaths. We've just kind of been fixing problems as they come. And what most of the governors, ours included in New York, have been doing is saying we need these ventilators to prevent what is going to come, what is inevitably going to be here, which is thousands and thousands of people needing hospitalization. And if we don't have the vents ready before they're here, there's no way to save lives. We're going to have to make decisions like they're making in Italy, which is deciding who gets a vent and who dies. And that's not something that we should be doing in the most powerful country in the world. When we know that problem is coming, we should be fixing it ahead of time. We shouldn't be waiting until it's here and then saying, well, we just can't do anything about it.
Well said, Doctor. Excellent point right there. And thank you again for joining us once again here. Big concern. Are you going to get the vent or are you not going to get the vent? You're going to live, you're going to die. Those decisions are being made as we speak right now across the globe. If you're just joining us, you are watching the daily coronavirus update live from Fox. My name's Mike Mibach. We've talked about a number of populations impacted by this, again, from the medical community to the prison population to the homeless population. We've gotten a lot of talk about pets as well. When does the coronavirus impact pets or not? Can I take my pet outside? Can the pet have it but not have symptoms, but can that pet give it to me as a pet owner? All good questions. I get it. I have a dog myself. And for more on this conversation, I want to bring in Dr. Lee Hoffmeister to talk about this, a veterinarian yourself. And maybe the first question is is this virus threatening to pets or not, Doctor?
Good afternoon. Thank you for having me. According to the American Veterinary Medical Association, there's no risk to our pets. There's no evidence that the virus SARS-CoV-2 that causes the disease COVID-19 can be transmitted to our pets.
So my concern would be, Doctor, I guess they're called formites. So my pet maybe can have it or it's on the fur and can pass it along to my children, but doesn't necessarily impact the pet, him or herself. Is there a possibility? Because I know the virus, they say don't touch metal, don't touch plastic. It tends to live a little bit longer, but could it live I'm just going to use my own dog as an example, but on the fur?
That's a valid concern and a common question that I get as a practicing veterinarian. Right now, we all need to be practicing very good hand washing, very good sanitizing of our hands and our iPhones and doorknobs and all of that. And our pets are no exception to that, you know, bathing them regularly, washing their food and water bowls. But right now, there's no evidence that pets can be a fomite for this disease.
Any evidence about being a dead-end host where they get it, no symptoms, can't even pass it along?
There's research being done, but again, you know, even with the 2 dogs that came up positive in Hong Kong, they never developed clinical disease, and several dogs in those households also continue to test negative. So the jury's still out on that.
You know, as a veterinarian, are you getting more calls? You know I haven't called my vet. I didn't seem too concerned about it. But have you yourself been getting a lot of calls from concerned pet owners?
You know, we're open and we're continuing to see patients. And, you know, my clients are pretty relaxed. I think maybe a little too relaxed about coronavirus, but, you know, their main concern is preventative care and making sure their pets are still taken care of. You know, vaccinating our pets is still a life or death situation. So as our clinics are remaining open, preventative care is of utmost importance, especially now. People are spending more time with their pets. People are with their pets more often. They're even going on hikes to the beach with their pets. And this puts our pets at risk for external parasites like fleas, ticks, mosquitoes. And at a time like this, you know, I recommend using a product like Provecta Advanced that not only kills, but it repels these external parasites so that they do not cause or transmit any disease to our pets, and continuing to keep our pets safe.
All right, Dr. Lee Hoffmeister, a veterinarian, joining us and answering those questions about our loved pets. Doctor, thank you for your time. I appreciate it.
You're very welcome.
Okay,
Take care.
I know another concern out there is shelters, and that people would be dumping pets off at shelters. Hopefully that's not the case, as it seems that pets are okay about this. Washington State, 2,600 cases of coronavirus. More than 130 people have died. Governor Inslee addressing reporters right now. Let's listen into his news conference.
To spring to this, to come to some relationship with the federal government where we then could make good priorities of where these assets go and drive the hardest bargain with these sellers. It won't surprise you that the sellers are trying to get some pretty outrageous prices right now. And if the federal government can become the buyer, they got a lot better bargaining power than just the state of Washington. So I'm not going to relay the specifics of that call, but I'm hopeful that this can be considered. And I know that there are other governors who share this view.
Now we're going to go to Daniel with the Seattle Times.
Yes, thanks. You showed the graph of showing that the rate of cases may be slightly decreasing. Well, where are we on the curve of actual cases rather than the rate? Are we getting close to the peak? Do you know that? And how does that relate to
We put it up, Sam.
of our hospital system?
Yes. By the way, before I forget, I want to mention a couple things. I thank the president and the vice president today, too. I want people to know that there is good communication going on with the White House. We are making suggestions, but I'm appreciative of that communication. And we're looking at this graph. I'm going to answer your question, but just a moment. I don't want to forget this. This graph shows the statewide numbers on a logarithmic scale, which is a statistical term, to show the change in the rate of increase. It does not show what is going on in certain parts of the state. And this is of great concern because while we've been able to lower the curve just a little bit in the central Puget Sound core, we are not lowering it in other areas in the state of Washington. So this is the average across the whole state. And so it might give you a false sense of security to look at it, because in many areas of the state we're not bending the curve, and those communities are looking for a wave of fatalities in their communities if we are not successful for doing that. And that is why this statewide stay healthy or stay home, stay healthy is so critical across the state of Washington. Now what this shows, and I could spend about 15 minutes explaining what logarithmic means, but basically it's a way of expressing the rate of change in any phenomena. And so you're seeing that it looks like
the governor of
we've had a
Washington
very
there addressing
modest
reporters. Again, I mentioned Washington State currently with more than 2,600 cases of coronavirus. 133 people have died. Unemployment, we're talking about it earlier. Nearly 3.3 million Americans applied for unemployment benefits just last week. As we take a look at the market here, investors don't seem to be too worried about that number. I think they were more concerned about the U.S. Senate and what they did last night, that the senators went ahead and gave the green light to that stimulus package, $2.2 trillion plan. You can see the Dow Jones up more than 5%. The NASDAQ and S&P 500 both up more than 4%. Joining me now from the city of Los Angeles, I want to check in with Winnie Sun, financial advisor with Sun Group Wealth Partners. Winnie, thanks for joining us.
Thanks so much for having me.
All right, let's talk money. You know, I was watching a 60 Minutes piece on Sunday, and there was in a report there were individuals, people were taking out hundreds of thousands of dollars in cash because they were so scared about what was going on. Should people be moving cash like that if they have that much, or even just $1,000, or should they be moving different types of investments?
Yeah, I don't think they should be moving cash around. I don't think that we're at that point where you need to be worried about doing a cash run. In terms of your investments, that's a whole different thing. It really depends on your time frame. If you're an individual that you're going to be retiring, or you're planning to retire this year or in a shorter amount of period of time, then it would make sense to speak with a financial advisor and check up and figure out if you need to reallocate some of your investments or your 401k plan. But otherwise, you see what's happened the last couple of days. It goes down quickly, but it also has a potential to come back quickly as well.
Okay, in that the bill that the Senate passed on the stimulus package, what do you like, what don't you like? And I know you probably haven't read it toe to toe. It's a big bill, but so far from what you heard, the bullet points here, what don't you like about it? Or maybe there's something missing.
What I don't like about it is I think that there's a lot of people that I feel like aren't going to be included in this plan. I mean, I think there's a lot of people out there who are going to, but then there's others who perhaps did well last year, the year prior, but this year they've lost their jobs, they're letting their employees go, they're at the risk of losing their businesses and their companies, but because they had higher income prior, they're not going to be part of this stimulus package. In addition, some people who haven't been filing their taxes, or they're in a situation where, they're just behind on their taxes. Are they going to get money? I think that's something that we have to yet see. Right. Because it's all based on tax return or your Social Security statement.
Some people, we've had stimulus packages in the past, and getting that $1,200 check at this time around does help families out there.
It does.
Is it enough? Is it too much? I mean, that's the debate some people have. I think a lot of Americans out there may say it's not enough to pay all my bills. But saying that, what do you like about this package?
Well, I love that they're doing something about it, and they're getting money to people that really need it. Really, hopefully quickly, within 3 weeks, right? So I think this is good because a lot of people are filing for unemployment. This will sort of help bridge that amount, so they're getting closer to, for a lot of people, the average employee makes about $1,000 a week. So it'll get most people to close to what they were making per week prior to this crisis. So that's a good thing. So they'll be able to buy medication, they'll be able to buy groceries, and hopefully breathe a little bit. And that's a positive because we need people not to panic.
Winnie, I have a friend who was early last month, when his family decided to sell their house, and they sold it, multiple offers, went and bought another house, had that done. And I was telling him, I'm like, you just did this, just maybe a week or two in time, because right now we're seeing a lot of people are taking the homes off the market across the country. If someone's interested in buying a home right now, what's your recommendation in regards to spending money to buy a house?
Spending money to buy a house, I think it depends on your situation. I think in most cases it's going to be hard to buy a house right now when you can't visit the house because you really have to hunker down and stay home. But if you're in a situation where you're looking to buy a house and you're thinking, well, interest rates are all-time low, then you could. I just would say the majority of people should not go that direction. I think unless you're able to buy a house sight unseen and you're financially able, in case this house drops more in value and the mortgage, you have to continue to pay the mortgage. I think right now it pays to be more fiscally conservative. Keep the money liquid, keep it there for your financial lifeline, if you will. Don't get too aggressive right now.
Yeah, but at the same time, I mean, we've seen what the Fed has done. You know, I mean, in regards to cutting the rates, I mean, some would say they're just giving away money right now, that it would be a great time to take that chance maybe and get the loan and then buy the house. I mean, what do you think about the Fed's move so far?
I think it's been good, especially those of you who are sitting on existing mortgages and your rate is maybe 4.5% or higher. I think this might be a great opportunity for you to consider refinancing. The big caveat, though, of course, is if you have income. So you've had to be able to show income to get a mortgage. Same with if you're going to buy a home, right? So are there great deals to be had? Absolutely. Like you said, a lot of people are taking their homes off the market because they don't want strangers walking into their homes right now and potentially contaminating the home as well. So I think that a lot of things to consider, but I think right now, overall, I would consider refinancing, keep your expenses low as possible, and keeping some cash on hand in your checking and savings account so that when you need to use it, you have access to it.
Yeah, I know a lot of people have been losing their jobs, unfortunately, over the last couple of weeks, but if they can save whatever money they're pulling in, you know, that's why you save money for moments like this. It's a good reminder. When you look back at 2008, Winnie, I mean, when we went through that recession, I guess you could say it took about a decade to recover to where we were just a couple of years ago, really to where we were just a couple of months ago. What do you foresee in the future? Do you foresee this recovery being as long as the one we just had?
You know, that's a good question. I think what's interesting is that we fell so quickly. This was an unexpected experience, but if you take a look at back in history on when SARS occurred, right? The market dropped pretty dramatically over 3 months. It stayed down about 3 months, and it took about 3 months later for things to get to be a little bit more normal. Now, interesting enough, if you take a look at this market, it dropped so quickly. But also with a little bit of good news coming out of the government the last 3 days, look at how quickly the market's also showing that people are feeling like at these levels, there's going to be some value there. Maybe bargain hunters are coming in. Some smart money might be coming in. And I think long-term, if you have a long-term horizon, you're planning for things like your child's education, maybe your future retirement, and you're in your 20s and 30s and you have the risk tolerance, it does make sense to look. There are some values out there. If you've got the time, I think there's opportunities for you.
All right, Winnie, appreciate your time. Thank you very much for the conversation.
Thanks so much for having me.
Of course. You are watching the Daily Coronavirus Update live from Fox. My name is Mike Mibach. We do this again beginning at 10 in the morning every weekday, starting on the West Coast, 1 o'clock in the afternoon on the East Coast. Today is March 26th. That's an important day in the sports world. For many of you who are baseball fans, today was supposed to be opening day. For all you baseball fans out there, maybe even for Little League, should have been up and running, but I know a lot of Little Leagues out there are not. It's a day when thousands of people would come together in baseball stadiums, ballparks across the country and celebrate their favorite teams out there on the field. That is not happening. And instead, we're all coming together as one country as we continue to fight this pandemic we are experiencing. When will it end? No one knows. Let's turn back to Dr. Latour from NYU. You know, we don't know when it's going to end. All we can do is worry about what's in front of us one step at a time, day by day. And I guess, you know, the president has said April 12th, that's Easter, that things need to get back up and running. What do you think of that? April 12th date just being thrown out there?
I think that the April 12th date is completely unrealistic, to be honest with you. I think that if you look at the data and information we have available to us, which is China, which is South Korea, the only way to really get rid of this is to practice some serious social distancing and self-quarantine, as I mentioned. In fact, in China, what they did is really in the Wuhan province, they really shut down everything. They were spraying the streets with sanitizer, essentially, and they were penalizing people with threatening jail time if they were to leave their homes. We obviously cannot do that in the United States. We have civil liberties here. We are, you know, free people with a lot of rights, and so that's not going to be possible here. But we need to do as close to that as possible to flatten the curve. And so to think that without putting in more strict limitations on people going out and about, that we could have this end in a matter of a few weeks is really, really, really unlikely, and frankly, it's irresponsible. I understand that, this country cannot shut down for months. It's just not possible. But what we have to accept then is that more people are going to get sick and more people are going to die. So we have to make a decision. What's more important? The lives of those people that we love with chronic medical problems, elderly people, pregnant women, and, as we're seeing, even younger people, or business and money. And so that's going to be a very difficult decision that our country has to make. And we're going to have to deal with the ramifications if we don't make the right decision.
Yeah, I have a family, 2 children, a wife, and I also take care of my 81-year-old mother who lives with us in the same house, and I worry about her every day. Every morning I wake up, and I'm concerned about what she does, and it's very difficult, I understand, for senior citizens, especially the elderly out there. So you mentioned social distancing. We've heard it. We understand it. But doesn't social distancing, doctor, need a partner named testing? I mean, if you put the two together, that's a lot more powerful than just one by itself.
Right. So there have been a lot of theories of people throwing around universal testing. I think that in theory, that's great. If you have the resources to do it and you can basically decide, if we test everyone, who should stay at home in quarantine and who shouldn't. The issue is that this is very fluid. And as I mentioned, we can't keep everyone at home, and we can't test every United States citizen, resident, what have you, on the exact same day. So let's say you test everyone and you do it in a staged approach, and one person tests negative. 2 days later, they may be exposed by someone else, when whatever situation they are, whether they're healthcare provider, FDNY, NYPD, or police officer, fire department, EMS. Then they're going to be positive, and during the 2 weeks that they are asymptomatic, which is the longest incubation period for this virus, they may be spreading it. So I don't know that universal testing is really going to nip this in the bud. But I do think that if we had more testing available, it would absolutely be helpful. And like I mentioned, it's really an issue with supply chain. Now, Quest Diagnostics is able to run the test if you can provide them with a sample. But unfortunately, the actual swabs that go into your nose or your throat, however they're swabbing you, those are what are running short. And those are actually made, many of them, in Italy, which is why we're running out of those supplies. And so it's a supply chain issue. It's very fragile, and a lot of our supply chain is very vulnerable because of what's happening in the world.
Well, Dr. Latore, thank you for your time over the last couple of hours. I've really enjoyed our back and forth, and you're filled with information. I'm glad we could pass it along to our viewers. Thank you again.
Thank you for having me.
Of course. We're in a fight. That's the summary, I think, from Doctor right there. We're in a fight, and as I mentioned, we're all in it together. That's an important note as we move forward, not only the rest of this month, not only April, but also May, June, and into the summer months. That is going to do it for this broadcast, but the stream will continue from Arizona. I want to emphasize that. The folks at Fox 10 Phoenix are going to keep bringing you the latest live pictures and news conferences that we've been dipping into from all over the country. You can visit coronavirusnow.com for the latest news.